Welcome, everyone. It is noon, so we're going to get started. Welcome to Caraconference 2021. My name is Megan Green, and I'm the Community Investment Coordinator at Caracol. And we're so excited to have you here today to listen to our presentation on intersectionality. So before we begin, I am going to go over some housekeeping tips. I can get my computer to recognize. So if you're unfamiliar with Caracol, we do encourage you to visit our website or follow us on social media to learn more about the great work we're doing. And if you do feel extra social today, please feel free to tag us at We Are Caracol and use the hashtag Caraconf. I think that we are all probably very familiar with Zoom by now, but today, if you would like to use that chat function for any technical questions that you may have or any general comments that you have for the presentation today, please use that chat function. You can also use the Q&A function for presenter questions today. So Kersha and Kim are going to be listening to some of those questions. I will be moderating, and when there is a brief moment for us to ask those questions, I will be sure to do that. If you are using a mobile device today, you can also use that chat and Q&A function. So the chat button can be found at the bottom right-hand part of your screen. And you'll just click those three buttons and go on to chat. And then you can also find that Q&A section up at the top right of your screen. Make sure you click Q&A and not that leave button. Today's conference would not be possible without the support of our sponsors. So we would like to thank them right now. Our presenting sponsor, Maytech, Midwest AIDS Training and Education Center. Our leading sponsor, Gilead Sciences. Our conference sponsor, Thera Technologies. And our conference supporters, E19 and Janssen. We do also want to share with you today a little bit about the Ohio modernization movement. In the United States, more than 32 states, including Ohio, have unjust and outdated HIV laws. And the Ohio Health Modernization Movement's mission is to replace those fear-based stigmatizing laws with evidence-based non-discriminatory laws that protect public health. So to learn more, you can go to ohmodernizenow.org. Following today's info session, we'll have a mini info session from Lori from Thera Technologies. So please feel free to stay on after that. And finally, after today's session, there will be a link to fill out your evaluation of today's presentation. And this is required for CEUs. So we do ask that you please complete this by the end of the business day today, being 5 p.m. We recommend this for all attendees. But again, if you want those CEUs, please be sure to fill those out. And finally, it is my pleasure to introduce today's speakers on the subject of intersectionality, race, gender, and sexuality. So today we have with us Kersha Deibel and Kimberly Mason. Thank you both for joining us. We're very excited to have you. I'm going to read a little bit about them really quickly, and then they will take it away. So Kersha Deibel is the president and CEO of Planned Parenthood Southwest Ohio. Prior to joining the team here, she spent over 8 years leading and organizing with Planned Parenthood Federation of America and Planned Parenthood Action Fund in Washington, D.C. There, she led the team to run winning electoral campaigns that centered on the lived experiences of Black, Indigenous, people of color, LGBTQIA+ individuals, young people, and patient advocates at the local, state, and federal levels. Her experience is enhanced by her Bachelor's of Social Work from the University of Cincinnati and a Master's of Public Health and Master's of Social Work from Washington University in St. Louis. Kimberly Mason is a Community Education Manager with Planned Parenthood, Southwest Ohio. Kimberly works to promote anti-racist sex education while advocating for and teaching sex-positive, comprehensive, and inclusive sexuality education. She has delivered education to youth, people with disabilities, staff, parents, and professionals in schools, juvenile justice centers, community organizations, and other spaces. Welcome to you both. Thanks for being here today. And I am going to stop sharing my screen so that you guys can take it away.
Awesome. Thank you so much, Megan. Hi, everyone. Thank you to Linda, to Trisha, to Adam, to you, Megan, as well, and the entire Caraconference team for having us, for having Kim and myself in Planned Parenthood Southwest Ohio here today. From the moment that I stepped foot into this role, Linda and really the entire Caraconference team have welcomed me, as well as the organization, in with open arms, and especially in turbulent times here in Planned Parenthood's history, and also just the history of the reproductive health, rights, and justice movement. We cannot thank you all enough for just being good partners and stewards for our patients and for people who need access to care. We are thrilled to be here today, and we're hoping to conquer by the end of our hour here with you all a few key objectives. One, we hope that you walk away with an understanding of the term intersectionality. I'm sure many of you are probably already very familiar with the language, but there may be some folks who may not be as familiar. So we hope you walk away with an understanding of not only what the definition is, but also how it pertains to race, gender, and sexuality. Also, a comprehension for the relationship between a person's overlapping identities. We know that probably the folks on this line have lots of various identities that you live with every day, and we want to ensure that you understand how your identities overlap with and fit into the language around intersectionality. We're going to define reproductive oppression and reproductive justice, as well as hope that you all leave with one action item and one new opportunity for self-accountability to ensure that we are creating a world that is even more equitable. Or more equitable than what we currently have. So to get started, I'm just going to share a little bit about myself. I have been in this role now inside Planned Parenthood Southwest Ohio for 3 years, but I am not originally from Cincinnati, which is where I'm located right now. I'm actually from a small town in Northeast Ohio called New Philadelphia. It's located in Tuscarawas County. Put in the chat if anyone's familiar with Tuscarawas County or New Philadelphia. These are my parents, my mother here on the right, my father on the left. And as you can see, I'm like the perfect combination of the two, right smack dab there in the middle. New Philadelphia is, it's one of those small towns that is known for high school football, cornfields. My little brother Jaden had 2 goats named Dodge and Skittles growing up. So it is your queen-essential rural small town. And as you can potentially maybe imagine, as a young woman of color growing up in this small town where 99.9% of my peers were white, I had many interesting conversations, many interesting experiences. And one that I can actually imagine to this day and remember to this day is I was in a class and it was 7th grade, and the teacher was going around the class telling us what we were going to be when we grew up. And I think that there are a few educators on the line. So just word of advice, do not do this activity ever. So he was going around and he told my best friend Jocelyn that she was going to be an Olympic athlete. My other dear friend Courtney was going to be an artist. And when he got to me, he said, Kersha, I think you're going to clean houses. You're going to be a maid. And in that moment, it took my breath away, right? And while I knew that there was nothing wrong with cleaning houses. My grandmother cleaned houses for many, many, many years in her life. Family friends also had careers in house cleaning. But what I did know and understand was that he was trying to take my voice away, right? He was trying to disempower me from living my own dreams and the dreams as a 7th grader that I was thinking about for my own career. And all I wanted to do in that moment was just crawl in a corner and hide because I was so embarrassed. I was so embarrassed to be in front of my classmates and have that experience. And so as you can imagine, the only thing that I wanted to do, I went through, the rest of my childhood, and I had lots of good experiences as well. But as you can imagine, growing up being different, right? I was a person of color. I had big, huge curly brown hair. All of my friends had, this perfectly stick straight blonde hair. I had a bigger body than all of my friends. I just experienced the world very different than many of the folks that lived in New Philadelphia. So when I turned 18, 18, the only thing I wanted to do was get as far away from New Philadelphia as possible while still getting in-state tuition, because that was really important. And so I came to Cincinnati. And I came to Cincinnati, and I went to the University of Cincinnati for social work. And I believe there are a few social workers on the line. And it was at my freshman year in college. I lived in Calhoun Hall at the University of Cincinnati. And my freshman year, my stepmother, she picked me up, put me in the car and said, "Come on, Kersha, we're going to Planned Parenthood to get birth control." And I had never heard of Planned Parenthood before. It was nothing that, we had in New Philadelphia, Ohio, but I trusted her. So we get in the car and we roll up to Planned Parenthood. And of course, we see all of these protesters. The only thing I wanted to do was call my father and tell him to come pick me up, because my stepmother had made a grave mistake of bringing me to this place to get healthcare. And there were all these protesters on the outside. But she assured me that everything was going to be okay. And it absolutely was. I went in and I had the best healthcare. I finally, for the first time in my life, I was talking about sex. I was talking about my own sexuality. I was talking to the person on the other line in a way that was affirming to me and my own lived experiences. But what I realized is that the people that were on the outside, right, the folks that were chanting that I didn't quite understand what was happening, they looked very different than the people that were on the inside of the organization, right? The folks that were sitting in the waiting room, we were predominantly women. We were predominantly women of color, Black women. And the folks that were on the outside were predominantly men. They were predominantly white men. And so I started to ask questions. I started to talk to my stepmother. I started to actually take women's studies classes in college and start to understand what was the difference between reproductive health, reproductive rights, and reproductive justice. And we're going to talk about that in just a moment. But from there, I went on to, as Megan said earlier, I actually went on to intern for Planned Parenthood of the St. Louis region when I was in graduate school, and most recently went to work for our national office in Washington, D.C., running political campaigns and working on campaigns to ensure that we were electing people who represented our values as an organization that really ensured that our patients understood who we were and what they needed. So it's Planned Parenthood where not only I as a patient began to really understand the various intersections of my own personal identity as a fat, as a Black, as a queer woman from the Midwest, and how I actually experienced the world, but also as a volunteer, as an intern, as an employee. I got to see every day how our patients' lived experiences are shaped based off of the myriad of identities that they experience. Many of our patients being Black, white, low income, Indigenous, folks living in rural communities with lack of access to running water and technology, single mothers, queer, transgender, non-binary, bisexual, people with different abilities, folks living with HIV who want to be parents and are so scared and have so many questions, right? And the list goes on and on. So now it is upon all of us to really interrogate every single structure and the systems that we as individuals continue to perpetuate within ourselves. Because when we can understand how race, how gender, how sexuality, and class operate together, we realize that we actually need a more nuanced and complicated way to understand our patients' or our clients' lived experiences and frame our decision-making around them. And I know we have some nurses on the line, we have social workers, we have folks in public health, and every single one of us are going to be interacting with people, right, at some point. And is it upon us? It's upon us to be able to frame our decision-making as we're creating policies, practices, decisions across our organizations, that we understand how people show up with their full identity and as their full self. And this is precisely why intersectionality matters. Having a framework that helps us understand how race, class, gender identity, sexuality, and the systems that hold them up operate through power and privilege can be so powerful, y'all. But we can't just say that we're intersectional, right? And continue to operate with the same power structure that we have today. Intersectionality is not coalition building. It's not a talking point. It's not a buzzword. As I know, it's been, buzzing around for years and years. And Kim's going to read the definition for us just in just a second. But It's a lens that we have to work hard to apply to our choices. It's a framework for our choices and decision making. And it's about who we prioritize and how we resource the work. So over the next hour, Kimberly Mason, the manager of education at Planned Parenthood Southwest Ohio, and so much more that she gives to the organization, is going to be my co-presenter. And I hope that we can walk you through some of these definitions, and I hope that you feel more confident and comfortable exploring the complex systems and structures that you all experience every day, and feel confident trying those on. So Kim, since I don't believe everyone else can hear or has an ability to speak, we're going to be relying on each other to bring some more voices into the conversation. Kim, are you able to read the definition of intersectionality for me?
Yeah. Intersectionality is a term first coined in 1989 by the activist and scholar Kimberly Williams Crenshaw. Intersectionality is a framework that helps us understand the multiple identities we each embody as individuals and how each of those identities impact our lived experiences as we move through the world at the individual, familial, oh my gosh, that's hard to say that word, institutional, systemic, and structural level.
Absolutely. Thank you so much. And I just want to point out the Dr. Kimberly Crenshaw. If you don't know about Dr. Crenshaw, please look her up. She is the person who first coined the term intersectionality and is a brilliant, brilliant scholar. But to just dig into this further, because we all have multiple identities, right? We use intersectionality as a framework to understand how each of these identities are impacted by forms of oppression, domination, or discrimination, and how they actually interrelate or create a system of oppression, or to create a system of oppression. And this gives us a more robust vantage point of how we and others may actually experience the world. Intersectionality holds that the classical conceptualizations of oppression within society, such as all of the isms we know, right? Racism, sexism, biphobia, homophobia, sizeism, transphobia, and belief-based bigotry do not actually act independently. You can see the diagram on the right-hand side, that all of these systems and the isms, they don't act independently of one another. Instead, these forms of oppressions, they interrelate, right? Creating a system of oppression that reflects the intersection of multiple forms of discrimination. Intersectionality is the framework that helps us understand the multiple identities that we all bring to the table and how we experience the world. Again, I am a woman. I'm a woman of color. I'm fat. I'm able-bodied. I'm middle class. I'm college educated. And if you go back to my example earlier, you know, the experiences that I had as a young person growing up in New Philadelphia, Ohio, intersectionality creates this space where it's really hard to unpack, why did I have that experience, right? Did I have that experience because I'm Black? Did I have that experience because I'm a woman? Did I have that experience because I have a bigger body? And intersectionality says it potentially is because of all of the interwebs, right? And it becomes very hard to untangle the web. The next slide here, you can see the beautiful Audre Lorde quote that is, "There is no such thing as a single issue struggle because we do not live single issue lives." And our next framework around reproductive justice is when all people have the economic, social, and political power. I just have to repeat that. When all people, every person that we work with has the economic, the social, and the political power and resources to be able to make healthy decisions about their bodies, their sexuality, and reproduction for themselves, their families, and their communities in all areas of their lives. Just take a minute to take that in. Can you imagine when all folks, that is freedom, right? When all people, that's justice, when all people have the economic, the social, and the political power and resources to be able to make their own decisions about their own bodies, their sexuality, and reproduction for themselves and their families. Whew, gives me chills just thinking about. This term was actually first came about at the United Nations International Conference on Population Development in Cairo in 1994. It was created in communities of color by women, specifically Black women of the Global South, as a name that truly represented their work and movement in a way that the traditional reproductive rights frame actually didn't. And Kim later on in the presentation is going to talk a little bit more about that history and what were the historical connotations that were happening in those moments. Reproductive justice was a response to marginalization, right? The term was created because women of color and women of the global South, they actually weren't having the same experiences represented in the broader movement. They were being blamed for overpopulation, not addressing issues of forced sterilization. There was a singular focus on abortion rights, not engaging in the fight against poverty, for healthcare and other issues that have significant impacts on the ability of women of color to actually have children. It challenged the rhetoric of choice with that of justice, right? Because at the end of the day, what is choice when there are so many restrictions on people's bodies? We can take some most common examples. I'm sure many folks have seen the atrocities that have been happening in the state of Texas around SB 8 that are restricting people from accessing abortion care in the entire state of Texas, and people having to find childcare, hotel, move to another or go to another state in order to access basic reproductive health care. Ohio recently passed a budget amendment that actually allows providers to discriminate and turn away people based off of anything, right? Based off of sexual orientation, potentially based off of race, right? And how that care can actually impact LGBTQIA plus communities, BIPOC communities, et cetera. And also just the lack of access to quality sex education. What is choice when people can't actually access reproductive health care or healthcare in general? So we begin to see choice as a response to taking away rights, right? And begin to see justice as a response to oppression. Reproductive justice is really about the ability to choose if and when you can have children. Now, we have a few different frameworks here. There are three arms at work in the movement, what we call reproductive freedom, when all people can have the freedom to parent and to have children if and when they choose. The first is reproductive health. Kim, can you read the definition of reproductive health for me?
Yeah, this emphasizes necessary reproductive health services.
Perfect. And reproductive health is actually the direct service arm of the movement. It includes clinics, shelters, and any direct service provider or point of resource distribution. Organizations that do reproductive health actually interact with people who need and use services directly. If folks could put in the chat box, what are some organizations that you know or familiar with that provide reproductive health care services or sexual health care services to community members?
Oh yeah, the Northern Kentucky Health Department.
Yep. Thank you, Cream. Equitas Health. Absolutely. Us, Caracal. Exactly. Planned Parenthood. Absolutely. Awesome. Yes, Caracal, Equitas Health, the health departments, UC Med Center, Family Planning Services of Lorain County. Those are reproductive health care organizations, right? Places that are providing direct services to people. What about reproductive rights? Kim, can you read reproductive rights for us?
Yes, so reproductive rights emphasizes gaining constitutionally framed legal protections for those services.
Perfect. So reproductive rights is the legislative arm, right? It's the legal policy arm of the movement. It includes advocacy groups that lobby. They might do public awareness via education programs, create materials. They potentially do research or create language around policy. What are some reproductive health or reproductive rights, rights organizations that you know? Folks who maybe have a more emphasis on the policy or the legal protections for the services that the reproductive health organizations provide. Planned Parenthood, Caracal, yeah. So we can be both, right? Any others? Legal Aid of Southwest Ohio, PPFA, absolutely. NARAL, exactly. Good. All right, and last but not least, of course, is reproductive justice. Kim, read that one for me if you can.
Reproductive justice stipulates that reproductive oppression is the result of the intersections of multiple oppressions and cannot be alleviated without strategies to address them all.
Absolutely. Cannot be alleviated without strategies to address them all, right? So reproductive justice is the movement building and the direct action arm of the movement. It includes outreach and recruitment of new leadership that actually centers leaders of color. So often it's mainly led by predominantly people of color and organizations that are led by folks of color. Cross-issue organizing includes trainings, convenings, and conferences and community-based work that is intersectional, right? Because again, we're not just fighting for reproductive health and access to abortion care, but we also might be fighting for the organizations that are reproductive justice organizations might be fighting for immigrant rights, right? Or economic viability or environmental justice, because we understand that in order to have true reproductive freedom, everyone has to be free. And if folks don't have economic justice, if they don't feel safe walking out of their street without the force of state-sanctioned violence, then is that true reproductive freedom, right? So reproductive justice framework looks at issues through a lens of the needs and the rights of Black, Indigenous, folks of color, LGBTQIA plus communities, et cetera. Can anyone give us examples of what are some organizations that maybe are reproductive justice organizations? Sister Song, absolutely, Marcella. And I'm not familiar with all of these, but I see ACLO. I'm not sure if that's ACLU or if it actually is ACLO. Trans Equity. Yes, absolutely. So Sister Song, you should definitely look up Sister Song. They are the key leader in reproductive justice, one of the key leaders in reproductive justice. And I think, many of these organizations, thank you for the clarification, while they might fight for the reproductive rights of people, right? Are they actually being led by people of color across the organization? Are they really looking and interrogating the intersections of all of the work? And while Planned Parenthood, we may strive to utilize the reproductive justice framework, we aren't necessarily a reproductive justice organization, right? Because we might have a particular focus on reproductive health or reproductive rights, but we aren't doing every single thing around all the various identities and the intersections. But we can still use the framework to ensure that we're trying to get a little further and closer to reproductive freedom. So let's actually really dig into what this truly means to create a world where people have the social, the economic, and the political power and resources to make decisions. Again, this is what reproductive justice is all about. Understanding oppressions, reproductive oppressions that take place in a person's life before they can actually even get to a place where they can make decisions about their healthcare. Y'all, we can talk about this in theory all day, but what I actually think Sonia Renee does a much better job of painting the picture in her renowned piece entitled Women Deserve, What Women Deserve, excuse me. So we're gonna watch this short video that Kim will tee up for us. And just as you're watching, keep in mind the question that we asked earlier. What does it truly mean to live in a world where people have the social, the political, the economic power and resources to be able to make their own decisions? And be thinking about what are the intersections that you're hearing in her piece. If folks don't know who Sonia Renee Taylor is, please look her up quickly after this. After you hear this presentation today, she is a former direct service advocate who has worked in HIV prevention and empowerment programming in Washington, D.C. She is the founder of The Body Is Not an Apology. If you haven't read her book, check it out. The Body Is Not an Apology. But she has Instagram and Facebook and all of the socials. So check her out afterwards. Kim, can you tee up the video?
Culturally diversified biracial girl with a small diamond nose ring and a pretty smile. Poses beside the words, women deserve better. And I almost let her non-threatening grin begin to infiltrate my psyche till I read the unlikely small print at the bottom of the end. Sponsored by the U.S. Secretariat for Pro-Life Activities and the Knights of Columbus. On a bus in a city with a population of 563,000. 4 teenage mothers on the bus with me. 1 Latina woman with 3 children under 3 and no signs of a daddy. one 16-year-old Black girl standing in 22-degree weather with only a sweater and a book bag and a bassinet with an infant that ain't even 4 weeks yet, tell me that, yes, women do deserve better. Women deserve better than public transportation rhetoric from the same people who won't give that teenage mother a ride to the next transit, won't let them talk to their kids about safer sex. I've never had to listen as the door slams behind the man who adamantly said, that shit ain't his. Even her wonder how she'll raise his kid. Women deserve better than the $300 TANF and AFTC will provide that family of 3, or the $6 an hour job at KFC with no benefits for her new baby, or the college degree she'll never see because you can't have infants at the university. Women deserve better than lip service paid for by politicians who have no alternatives to abortion, though I'm sure right now one of their 17-year-old daughters is sitting in a clinic lobby, sobbing quietly and anonymously, praying parents don't find out, or is waiting for mom to pick her up because research shows that out-of-wedlock childbirth don't look good on political polls, and Sarah ain't having that. Women deserve better than backward governmental policies that don't want to pay for welfare for kids, or health care for kids, or child care for kids, don't want to pay living wages to working mothers, don't want to make men who only want to be last night's lovers responsible for the semen they laid. Just flat out don't want to pay for shit, but want to control the woman who's had it. Acting outraged at abortion, well, I am outraged that they want us to believe that they believe that women deserve better. The Vatican won't prosecute pedophile priests, but I decide I'm not ready for motherhood and its condemnation for me. These are the same people who won't support national condom distribution to prevent teenage pregnancy, but women deserve better. Women deserve better than back alley surgeries that leave our wombs barren and empty. Deserve better than organizations bearing the name of land-stealing racist rapists, funding million-dollar campaigns on subway trains with no money to give these women, while wealthy middle-aged white men tell us what to do with our bodies while they wage wars and kill other people's babies. So maybe women deserve better than propaganda and lies to get into panties, propaganda and lies to get into office, to get out of court, to get out of paying child support. Get the fuck out of our decisions and give us back our voice. Women do deserve better. Women deserve choice.
Woo! All right. She is amazing, Desiree. And John, to thank you. Yes, what a strong message. Again, if you have not heard of the Sonia Renee Taylor, please check her out. But what emotions? What did folks feel after hearing that? What emotions were elicited for you? Kara, power but anger at the same time. Absolutely. Frustration, Christine says. Brianne says sadness, anger, but empowered. Absolutely, right? Like, I feel like I just want to march out there and and do the work, get to work. Catherine says, I can't believe we are fighting this again in my lifetime. Absolutely. Absolutely. Could anybody recognize where maybe, where were some of the intersections that she talked about? Thinking back to our definition of intersectionality, what were some of the intersections that she experienced in riding the bus? Poverty, income, gender, class. Sonia says. Absolutely. Absolutely. Anything else? Ageism. Young people having children. We'll wait for one more. Tasha also says, yeah, privilege, the power structures, right? And lack of resources and acceptance. Sexism, Catherine says. Absolutely, absolutely, and I think that you all have aced this quiz, and you're starting to identify. Yes, these are the intersections that make it extremely challenged, no matter who you are, right? No matter who you are, and all of the myriad of identities that you hold, in order for people to access healthcare, right? Basic reproductive healthcare on a daily basis. Thank you, Jaceel. Loneliness. Absolutely. Well, with that, I am now going to turn it over to Kim, who's going to actually take us through how did we get here? What is the historical analysis that can paint the picture for how we actually got to many of these moments? Kim, take it away.
Thanks, Kersha. Again, my name is Kim. My pronouns are she, hers, and I'm the Community Education Manager at Planned Parenthood Southwest Ohio. The work that I do is a lot about mentoring our sexuality educators in Planned Parenthood's National Sexual Health Hotline called Chat Text. I also lead our abortion doula program and aim to provide our healthy relationship education to incarcerated women. Now, Kersha defined intersectionality and the unique qualities of reproductive justice, but how did we get here? To understand this, we're going to briefly look at the history of the feminist movement, which has often been described as waves. And the idea of waves suggests that there is an ebb and a flow where the movement peaks at certain points and recedes at others. These peaks showcase the mainstream, whitewashed moments of feminism. The waves also suggest a sharp division between generations, when in reality it's been one long battle for equity. Some of the biggest moments or highlights of the waves are founded in the work of what many feminist activists, who were often women of color, were doing in splinter movements in a previous wave. So in the first wave we're going to look at here, we see suffrage, or the right to vote. So does anyone know what is said to have kicked off the suffragist movement in 1848? Maybe. The Seneca Falls Convention. So maybe you've heard of that. So the Seneca Falls Convention happened in 1848. And the 19th Amendment, prohibition may have helped, who knows? The 19th Amendment gave white women the right to vote in 1920. But the roots of the suffragists were actually planted in the abolitionist movement. Suffragists and abolitionists initially worked together to assert voting and civil rights for everyone. But with the passage of the 15th Amendment, which granted African-American men the right to vote, the movement's priorities divided, and voting rights for women of color were not allowed. Native Americans were granted citizenship in 1924 in their own homeland, but they were not granted the right to vote until much later. Long before the first wave of feminism, women's power and gender diversity was already recognized in Indigenous communities. They farmed, owned property, guided governance, and more. Children's identity was inherited from their mothers, and no child was seen as illegitimate. But this was rejected by white settlers bent on colonizing Native people and controlling women as property. Paradoxically, as white women began gaining rights, Indigenous families were being stripped of their rights. Citizenship became a mechanism to force assimilation. Thanks. Yeah, okay, that makes sense. And then in 1943, Asian American women were granted the right to vote through the passage of the Magnuson Act, but there was still broad disenfranchisement of Asian Americans. And does anyone know when the right to vote applied to Black, Indigenous, people of color? History test for everyone. Yeah, much later. Way further than the 1870. Yes. I can't see the name, but 1965. So the Voting Rights Act of 1965 guaranteed the right to vote for pretty much everyone else. So that was only 57 years ago, which is not that long. Some of our parents or grandparents or maybe ourselves have lived through this experience. Second wave is about 1960s. So, which brings us into The second wave movement, which started around the 1960s, this really emphasized equal pay and reproductive rights, specifically abortion and contraception. And again, this prioritizing of issues divided the movement, not just among different races, but alienated many lesbian and bisexual women from the feminist movement as well. And in the third wave, this sought to reclaim ideas, redefine gender roles, and embrace diversity. Diversity became the buzzword that tended to create limited opportunities of advancement for appearance's sake, leading to experiences like tokenizing and persistent microaggressions, rather than take strong initiatives to address the needs of the diverse communities they sought to uplift. And as of around 2012, it's believed we're in the fourth wave, which looks to be embracing LGBTQ rights, Black Lives Matter, DACA for undocumented folks, and climate change. But being that it's still in progress, the actions of today and what we do for tomorrow will define this wave in the future. So these are just a few of the consistent practices of reproductive oppression, meaning these events are strategies to exploit sexuality and reproductive labor in order to control individuals and entire communities. These events occurred during the feminist waves. The efforts to stop the oppression and exploitation of LGBTQ families, BIPOC families, people with disabilities and their families, low-income families, immigrant families, has generally been overlooked and underrepresented in the mainstream feminist waves, even though the work being done by non-white and or LGBTQ activists to address the deliberate and constantly targeted attacks of reproductive oppression had influenced the advancements in future waves. So there's a bunch on here, and there's certainly a lot that couldn't make it on this screen, but I want to point out two events. So in 1910, the medical model of childbirth forces out midwives in favor of doctors, hospitals, and medical interventions. And what was noticed here is that where midwifery declined, maternal and infant mortality rates generally increased. Infant and maternal mortality rates define the overall health of a society, and the US has seen the highest rates of this neglect. Ohio in particular has some of the highest rates in the nation, and people of color, especially Black, Indigenous, and Latinx people, experience an elevated risk of poor outcomes during pregnancy, and these disparities are rooted in racism. The other event I want to point out on here is in 2021, so this year, the Supreme Court of the United States upheld a ruling that allows foster care and adoption agencies to deny their services to LGBTQ plus families. This single event is a product of earlier oppressive events like the Defense of Marriage Act, sodomy laws, employment discrimination, the HIV epidemic, and other violations of human rights and bodily autonomy. So deep breath. Unfortunately, like I mentioned, there are an incredible number of cruel events that have occurred in our history, in the US history, that could have been added to this timeline. So think about what stands out to you from this small selection of reproductive oppression events that I've shared here. Many events have been repeated throughout history. Now I've highlighted 4 here that emphasize the use of birth control through forced sterilization, contraception, testing, and coercion to exploit Black, Indigenous, people of color, and people with disabilities. But these are not isolated incidents. Some other events that you can see repeated on here include separation and incarceration of families. And we also see male Supreme Court nominees accused of violence against women appointed to the nation's highest court in spite of testimony. So let's dive deeper into how privilege and oppression are intertwined. Privilege is a right or exemption from liability granted as a special benefit or advantage. Much of the power of privilege comes from the fact that it's invisible, meaning it's often accepted as the norm. As Kersha shared earlier in describing intersectionality, people have multiple identities and potentially cultures that make up their background. These identities may provide people with specific privileges as well as disadvantages. Most people have privilege, Many have multiple privileges. Some people have no privilege. Now, drop in the chat, what are some examples of privileges that individuals in the United States can experience? White privilege. Yes, definitely. Generational wealth, also tied into white privilege there. Able-bodied, yep, male privilege, cis privilege, straight privilege, yes. Educational opportunities, yes. Infrastructure, oh, yes, yeah. Yes, presentations without captions or ASL interpreters, yes. Access to technology, financial, thin privilege, pretty privilege. Food, neurotypical privilege. I'm gonna keep letting y'all go, got more. I think this really emphasizes that we have a lot of privileges in the United States, right? That much is clear. All right, I feel like we slowed down there, and that's totally okay. So we have privilege even when we didn't ask for it. So when social groups are given the privilege or advantage over others, it creates the system that benefits the privilege and discriminates against, marginalizes, disenfranchises, and exploits the individuals or social groups not in that privileged group. Privilege then becomes a tool of oppression when the privileges are normalized as the ideal that others have to adapt in order to survive. Recognizing a privilege or privileges that we own can make many people uncomfortable, but privilege isn't a bad word. It's easy to become defensive because many of us may have struggled in certain situations of our lives, and it can be hard to see that we may have also benefited in the same situation under circumstances unique to different parts of our identity. Privilege is intersectional, so that different parts of our multiple identities intersect to create a unique experiences, needs, privileges, and oppressions. So for example, white women can experience oppression of sexism and misogyny, but has the privilege of being white. Add in other aspects of someone's identity, and they may experience various benefits or added layers of oppression. So let's put this into a little bit of mental practice and talk about Texas. Not Texas in 2021, Texas in 2014. So for a moment, you might be thinking about the blissful unawareness we all had before the COVID-19 pandemic engulfed our lives. However, just a few years before that, in 2011, there had been 44 abortion providers in Texas. Now, just for some local perspective, does anybody have any guesses on how much bigger Texas is than Ohio? 3 times, 6 times, so somewhere in between you two, yeah, 6 times bigger. So by 2014, there were only 24 providers left in the entire state, nearly half gone as a result of laws targeting abortion providers, or what's known as trap laws. This had already been a steady decline since the 80s, when in 1982, there were 128 abortion providers in the massive state of Texas. But by 2014, the Rio Grande Valley in South Texas was already experiencing what everyone in Texas is experiencing right now, because they had no access to providers when health centers were forced to close. For some, they could travel further north for safe abortion services, or maybe they had the awareness to contact providers and abortion funds for support. For others, they went over to Mexico to access abortion pills. And many others, particularly those who were undocumented, who were minors, disabled, low income, could not leave and relied on the hope of finding abortion pills, contraception like depot shots, emergency contraception at places like flea markets, until police raids shut those down too. Now, we also know that a majority of cisgender, lesbian, and bisexual women have reported having vaginal sex with people who could get them pregnant, and at least 30% have been pregnant. And with about 50% of pregnancies being unintended, we can see that people with uteruses need access to abortion regardless of their sexual orientation. Now let's fast forward a little bit to SB 8 and where we are today. The majority of states around Texas have 24 to 72-hour mandatory waiting periods, meaning at least 2 trips are required for an abortion procedure and adding to expenses, among other concerns. But many immigrants and women of color simply can't leave due to things like childcare, job instability, transportation, fears of deportation, and actual immigration checkpoints. And the inequities their communities suffer continue. Now, within days of SB 8 going into effect, fears over whether the law affects the morning after pill arose. Now, it doesn't impact emergency contraception like Plan B, but hearing this demonstrates a bigger concern since some anti-abortion groups profess that certain contraceptive methods constitute abortion, and they argue that emergency contraception ends rather than actually prevents pregnancy, which shows this situation in Texas is more about the battle of reproductive autonomy than the single issue of abortion itself. And with abortion providers often being the same places that provide emergency contraception, if more providers close as a result of SB 8, more people will struggle to access birth control, sexually transmitted infection treatment, life-saving pap smears, and other forms of care. What's more, it will disproportionately impact people of color and LGBTQ people who already face higher barriers to safe and affordable treatment. So in that one example, we can see how whole communities face additional challenges unique to their gender, race, geography, sexual orientation, education, income, age, and disability. And it's simply not enough to say that healthcare, treatment, and support services are legal or available in some places. It must be financially and literally accessible to everyone. So understanding the history of reproductive oppression and the continued barriers and violations of bodily autonomy on Black, Indigenous people of color, LGBTQ, immigrants, and other communities shows us why we need a new framework that centers these groups. If policies ensure access to sexual and reproductive health care for the most marginalized groups, everyone else benefits. So, Black, Indigenous people of color saw a need for achieving justice. They recognized bodily autonomy and fertility cannot be understood without tackling the social conditions that affect it. And the cornerstones of the reproductive justice framework affirms that everyone has the right to decide if and when they will have a baby and the conditions under which they give birth. Conditions is an important word there. These conditions mean access to high quality care before ever getting pregnant, and social supports for sustainable health throughout pregnancy and after birth, including paid parental leave, postpartum support, stable housing. It also means that these conditions do not expand the gaps of financial inequality. So these conditions mean that people can give birth without shackles, even if they're incarcerated, which still occurs in more than a dozen states in the US. And it means without legislators, courts, law enforcement, or medical providers policing or controlling their pregnant bodies. The second cornerstone affirms that people have the right to not have a baby, as well as options and access to prevent or end a pregnancy. And this includes all birth control, meaning safe, effective contraception and abortion, plus unbiased sexuality education throughout their lives. And finally, the third cornerstone asserts that people have the right to parent their children in a safe environment. In safe environments with quality social supports like housing, food, education, parks, conservation and preservation of the water we drink and the air that we breathe, and without fear of violence from government and others, including destruction of land or resources and police brutality. Mainstream feminists of the past, who were often straight, white, upper or middle class, pursued and in some ways achieved some or all of the aspects of the reproductive justice framework, like political access, healthcare access, bodily autonomy, and other privileges. However, many Black, Indigenous people of color still have not achieved any or all of these goals to this day. The fight has been ongoing, and we can't stop now. Back to you, Kersha.
Beautiful. Thank you so much, Kim. I don't know if I was even prepared for the history lesson and the quizzes that we're taking. I feel like I need to read back up on my history to get those dates right. But thank you so much, Kim. We want to kind of talk you through how us at Planned Parenthood, how we're starting to recognize and also address the gaps, because as an organization that has been around, PPSWO has been around for 90 plus years. We've had some missteps, right? And there are opportunities for us over the years to start to chip away at the very systems that continue to hold up bias, hold up discrimination within our very own organization. And so we're hoping that over the next couple of slides that you all can start to think about, what can I, both as an individual, but also as a member of your organization, maybe you volunteer, you intern for, you work at, you as an employee, can also start to chip away at the very systems that reflect and continue to perpetuate the culture. So number one is we are also beginning to examine, what are our policies? What are the practices? What are the decision-making structures that me as a leader, as well as my leadership team, the managers, the directors inside the organization, how do we ensure that not only are we sharing power across the organization, but looking at what are the internal biases that we have and the systems that we're holding that perpetuate this white dominant culture inside the organization? And thankfully, we have an incredible board of directors. I saw a couple board members in the chat box. So huge shout out to them for also being behind and getting behind us really taking a closer look at this. Number two is that we are expanding care. If folks are not familiar, please visit our website at Planned Parenthood Southwestohio.org, and you can make a telehealth visit. But also, we are now providing gender-affirming hormone therapy for adults. So there's an opportunity for you to come in, actually work with a gender-affirming care ambassador, and they will take you through your entire visit and work with you through the visit and even after the visit to make sure that you're getting the best quality care. Number three is connecting across communities and fostering alliances. Y'all, I don't know about you, but we, especially social service organizations, nurses, social workers, public health experts, and so many other folks that are here on this line, y'all, we need each other now more than ever. So part of this work is also connecting across communities, not just looking at our homogenous groups of people that we work with every day, but also looking at how do we connect across different identities, different communities, and starting to foster those real live actionable alliances that aren't just performative, right? But they're actual alliances that work and that are connecting to all of the issues that Kim and I brought up earlier. 4 is sharing sexual health resources, best practices, and education models that work via our sex education programs. Kim, I believe I saw Marcella, Sarah Dalston, are incredible sexual health advocates for Planned Parenthood. I know Caraconference also has brilliant sexual health advocates as well. So it's a part of really sharing sexual health resources. How do we share best practices and looking at your own institution? If you are an organization that has resources and the ability to share those best practices, share them with some of the smaller organizations, right? Folks who may not be able to, actually be able to have the resources to do all of this work so that we can spread the wealth and spread the knowledge. And the last one that we have here, but definitely not least, is fighting for a representative policy change. We work very closely with Planned Parenthood Advocates of Ohio, and they are the advocacy arm, the reproductive rights arm of our work, and they fight every single day so that folks are fighting for policy change, not just the people who represent us in office, but also fighting for access to reproductive health care, ensuring that folks have access to HIV, STI testing, as well as sexual health education and abortion care. So again, these are just a few ways in which we at Planned Parenthood are addressing some of the gaps. But last but not least, I know Kim wants to take us through how can you all continue to be an accomplice in this work before we close out with some accountability measures to make sure that we are walking away with how we're all going to be held accountable to creating even more equitable environments.
Kersha, we had a question, and my brain is getting confused, so I don't feel confident answering this right now, but is the hormone replacement therapy based on informed consent approach, or do we require letters of recommendation from mental health professionals before receiving hormones? Do you know the answer to that?
It's a great question, Liam, and they do not. So please, if this is something that you're interested in, or anybody that you know is interested, we do not require a letter of recommendation from mental health professionals, and it is based off of the consent approach. And we've actually gotten a lot of questions about that from our navigator and a lot of concerns initially, and we were excited to make sure that we could get folks in as fast as possible to get them taken care of. Great question, Liam.
Thank you for clarifying. All right, so what are some things that you can do to become an accomplice? Start by educating yourself, and you've started here. That's a great first step. So Robin DiAngelo asked us to understand or uncover how race has shaped our lives. And think about it right now. Who do you talk to about race? Who do you not talk to about race? Let that sit in your brain. How do conversations of sexuality and gender come up and compare in your social groups? Practice centering race, just as you might center gender or sexuality, and reflect on how you've been socialized to participate or accept racism, sexism, homophobia, and transphobia. We can't talk about something like social class or income inequality without recognizing race, because to be poor and Black is different experience, and to be poor, Black, and queer is also different. Practice moving up and move back. So what I mean by this is that voices need to be heard, and people who are often quiet deserve to speak up and take up space. Those who frequently take up physical or verbal space should take a step back and listen to understand and not to respond. Another thing that you can do is to call in others. So it can be most difficult to break comfort and complacency when we're with our friends or other politically like-minded individuals because we're convinced we're woke or educated. But when white people are in an all-white space, we should be thinking more about race, not less. Consistently break the silence with others in your privileged group, talk with other white people about race, check your assumptions about sexuality, whatever it is. Practice interrogating your motivations. So we all have bias. It's a very normal, natural human component of our brains. We process a lot of information, so we're categorizing things, but we can recognize bias when we realize that it's unconscious. It becomes conscious, and we work to overcome it. So tune into the emotions that you're experiencing when you recognize a bias, and then remember to stick with facts over the assumptions that you make. Counter the stereotypes by making associations that counter the bias that you've recognized. Next, you can amplify marginalized voices. We need to center oppressed voices, and we can use our privilege to open the door for others. Privilege tends to carry more weight. So think about how can you use it? Accept your own privilege, and we can, and if decisions are being made for people who are not sitting at the table, get them a seat at the table without tokenizing, and then listen, believe, and make space for them, physical and verbal space. Now think beyond a one-size-fits-all approach. So what I mean by this is when we think about racism, sexism, homophobia, classism, ableism, climate change, all of these power structures and so much more are addressed in our society as single issue. But we don't have to choose between Black Lives Matter or LGBTQ rights or women's rights. Intersectionality is the understanding that the root of each power structure intersects and emerge from the same violent roots. Practice showing up and listening. Do this by increasing your contact with other groups. So one thing that we've noticed is that research shows prejudices decrease as people have more contact with different social groups. When we don't engage in those outside of our group, we are susceptible to groupthink, rather than expanding our power for creativity and innovation with exposure to new ideas and people. So listen without judgment, learn and engage with people of color, LGBTQ people, immigrants, people with disabilities, without silencing them. Don't assume gender identity or pronouns. Hopefully many of us have already started to break this habit, but get in the habit of checking with people. People will operate at their best when they don't feel they have to hide a part of themselves for your comfort. Now, we're all bound to make mistakes. We're human. And when we cause harm to others, they deserve a sincere apology. So know that intent is not magic. Just because you didn't mean to hurt someone, your words can still have power, and you are accountable for them, even when you have the best of intentions. A sincere apology is not, "I'm sorry you felt that way," or "I'm sorry if you thought XYZ. If you make a mistake, take a breath, apologize sincerely, thank them for their honesty, and move forward. Don't apologize a million times, because that puts the burden on the injured party to ease your distress. Spend your energy trying to be more mindful in the future. Another thing you can do is offer paid internships. So to land many entry-level jobs, people need previous experiences. College degrees are rarely enough to satisfy employers. Institutional barriers and financial obstacles put the most oppressed communities at a disadvantage. By limiting opportunities to only those who can afford to spend an unpaid semester, often in cities with high living conditions, we reproduce the very structures we are working against. And finally, a totally shameless plug here, advocate for sexuality education that is unbiased, sex positive, anti-racist, and inclusive of LGBTQ+ identities. Many folks on this call may be parents or know parents, and because you're likely working in this field of sexual health, and that's why you're on this call, the young people in your lives may be able to turn to you for access to sexual health information. But what about the other children at the schools where those young people you know attend? Only 33 states and DC mandate sex education. 34 states stress abstinence-only programming over comprehensive sex education. 10 states have policies that include affirming LGBTQ+ identities, while 8 states explicitly require instruction that discriminates against LGBTQ+ people. So that's a lot. I know. And you don't have to do all of them, and you don't have to do all of them at once. Take those baby steps. It's totally fine. But we want to thank you all for joining us today. Thank you to Caracal for allowing us the opportunity to engage with you all. My contact information is here on the screen if you have any questions or concerns. Please follow us on social media and check out our website by visiting ppswo.org and clicking on events to view our virtual library of recorded content for access to more professional development, parent education, and more.